Welcome to the 5 Codes podcast, where we discuss evidence-based methods to elevate yourself to the next level through optimizing the way you look, move, perform, feel, and connect.
So I just came out of the operating room with a really lovely patient who I had a very interesting start to my relationship with. When I was just thinking about this for my OR diaries for this particular week. When I first met this patient via my preliminary process, when she had sent photos in, and then I kind of went through and we ended up booking a consultation virtually. She lives out of town quite a ways. And when I first saw her photos, I, get a sense of where she's at, and she looked to be in her early 70s. And as I dove into her information, she was actually 60 years old. And so, that just kind of piqued me, and I kind of gave her some ideas of things we might talk about based off what she told me and what her photos. That's my general preliminary process. And when I actually got to talk to her on the phone, virtually, via a video call, it was on my agenda to seek to understand a little bit of what might be happening here with her. She had also seen some other surgeons in consultation and got some very interesting recommendations that she mentioned in her preliminary plan that I wanted to talk to her about, basically. But one of the things on my agenda was to just understand, okay, why are we looking like we're in our 70s when we're really 60? And, I had some suspicion. Oftentimes I see this with really stressful circumstances. And so when I ask this question, I can't be afraid to ask it, because I really want to deeply understand. If we're going to work together, we're going to have a really deep relationship. This is something that I value on a really high level. So I'm not afraid to have an uncomfortable conversation, not uncomfortable in a bad way, but just like a method to grow our relationship, grow my understanding. And so, I asked her in our original conversation, this goes back months now, hey, I noticed this, and, have you had something really stressful in your life? Has there been an issue like this? And I've had this happen a lot of times, and I've seen everything from, cancer treatments and then estrogen blockers like tamoxifen. That makes sense. That's going to change our tissue quality and the way that we age forward in our metabolic health. Our face unquestionably reflects our metabolic health, right? But sometimes that's other types of stressors. It could be life stressors. It's losing a child. It's having a really challenging relationship separation or something like that. And so, interestingly, as I started, asking her about this, it was tears, instant tears, and I could feel it through the phone, and it was heavy. I could feel it through the video call, and it was very heavy. And I asked, I want to sit and understand and know what's going on. And, we kind of went through her story, and it was tragic and stressful. And, she had said flat out, coming out the other side of this, I felt like I'd aged decades, basically. And she had been very fit and healthy and pulled all the levers before that she could pull, but nothing could prepare her body for this. And this is real physiology. Gets into a lot of our neuromodulators, we talk about stress hormones like cortisol, which is the big one, but when we really think about epinephrine and norepinephrine and how all of our adrenal glands are functioning and what they're releasing from a cortisol standpoint, it has an important impact on how our face ages, even in how it affects our sex hormone levels that change how our fat pads respond. But cortisol itself can be really disruptive to our soft tissue quality, our collagen, our elastin, the way that our fat pads age and respond. And she had that look on her face. Parts of her almost looked like aged in a way of malnutrition and types of things like that. And, there's sleep changes that happen. There's nutritional changes that happen. There's lack of self-care, lack of exercise, plus the cortisol. There's so many things that happen in these stressful situations that lead to premature aging. And I just instantly resonated and connected with her. And we sort of talked about what that meant. And the next part is well, how do we address that then? How do you change this, probably 15-year discrepancy in soft tissue quality and appearance to a baseline? And she, as she had recovered from her tragic event, still carried that burden, but felt like herself again. And you looked in the mirror and basically just saw this traumatic event every time she looked in the mirror, very misaligned. And so I really focus on the regenerative part of it in that setting. Like, yes, there's the objective, placing things back where they go, the gravitational components, but there's a big subjective, qualitative component to this as well. And it's interesting because when she had seen other surgeons, like for example, she had really hollow upper eyelids, like incredibly hollow upper eyelids, really heavy forehead, and a lot of things had changed. And her surgeon, she saw that we should do an upper eyelid surgery, an upper blepharoplasty. And I'm trying to tell her, like, that is looking only at the downstream effect of a bunch of other upstream things. She needed her whole forehead addressed and her volume replaced in her eyes. I'm trying to explain to her that, like, that would be like having hollow cheeks and gravitational changes and not liking your nasolabial fold, and the solution being cutting your nasolabial fold out instead of lifting and restructuring with volume or with fat transfer. It's a perfect analogy, actually, for you would never just go cut this tissue out along your face, just like you wouldn't on your eyelid, until you had everything appropriately lifted above it. This is a really common eyelid theme, but it was really applicable to her, where she needed volume and things 100 times more than she needed skin cut out of her upper eyelids. But the other surgeons, plural, that she had seen, that was like one of their first suggestions for her upper lids, because she noticed a lot of her aging and stress in her upper lids, which is very typical. That's how we communicate how rested we are and how vibrant we are. And so that gets into the whole neurobiology of facial perception. But she just personified a lot of these things. And when you looked at her, she looked sort of not as vital as she was in real life. And you quickly picked up on that when you talked to her. And I knew there was a mismatch. And the second I asked about it, she was, gracious enough to, kind of be vulnerable with me. And that led to a great relationship with us. And we did a very comprehensive, qualitatively focused procedure. We're supplementing with some of her own stem cells. We've banked some of her own stem cells. We've got a lot of good things going on for her in the long term, because, we're viewing this with a long-term mindset. We want to get her to a great place now. We want to work to maintain it. And we know that because of her previous stress and aging that, we'll probably be focused on some qualitative components. We've got the sort of the big heavy lift out of the way now. But, we're going to have a relationship for a long time. I'm with her. I'm not going anywhere. And, we've set ourselves up for that with some regenerative capacity down the road as well. So I'm always grateful when people are like, vulnerable enough with me or are willing to share that. And honestly, she would be a prime example of understanding that, having that hard conversation, leading to a completely different plan and a deeper understanding, and ultimately what's going to be better initial results and better long-term results for her down the road. So I thought that was really, it's moving to me and touching to me. And those are the types of relationships and the types of patients that I want to work with. So I thought that was worth sharing.
If you have any questions or topics you would like me to explore further, please leave them in the comments. I read them all, and they often help shape the future conversations here. If you would like to learn more about my surgical practice, you can visit clinic5c.com, where you will find additional information on my approach to surgery, recovery, and performance-focused care. I also want to be clear that the views shared on this podcast are my own and are not associated with or representative of my clinical teaching affiliation with the University of Washington School of Medicine, nor should this be taken as individual medical advice. Thank you for spending your time with me. I appreciate you being here, and I will see you on the next episode.